Joining us now is Dr. Sharon. She is a social epidemiologist at the Boys and Girls Club of Maryland. Good to see you.
Good to see you as well.
When I think epidemiologists coming out of COVID, I think Dr. Fauci.
Exactly.
I think that your jobs are different in what you focus on. Describe how the Boys and Girls Club put you to work.
Well, in reference to epidemiologists, we all use what we call the epidemiological triangle. And so the first is that we're going to be looking at that host, that pathogen or germ. Dr. Fauci would look at, let's say, COVID or AIDS, that either chronic disease or that communicable disease. A social epidemiologist looks at social constructors, right, or from a social content, an issue. For me, I look at the social germs, so whether it's hate, whether it's inequity, whether it's racism or genderism, I look at those and follow the research pattern from that perspective. So it's not just the public health, but also those social structures or structural issues and factors that impacts the health and wellness of individuals. And in this particular, we're looking at children and youth. As it relates to my work with the Boys and Girls Club.
And what I was going to say is that all those things sound like very adult topics, but there are kids who may walk into second grade who have dealt with hate or abuse or lack of food, and all traumas before 13, which is troubling.
It's troubling because it's not just that they walk in the doors with that. They are born into a country or a community, right, that those things exist before they were born. And so sometimes I think when we're thinking of children and youth, we assume the assessment of when we were growing up. And while trauma was there, we hadn't really researched from a generational perspective the impact, the experiences. They're much more intense. They may have different names, but it's still there. So you were born, meaning even in the womb, you're feeling trauma. Sure. Right? And then you come into a society that you did not ask to, but you are here and you're experiencing that. What's so traumatizing, even though we're using that word, is that for a child their age, they know that it's different and it doesn't feel good. But society has normalized it because you should be okay. You're young, you don't have any problems. And that really is a false, misnomer that people have. Children and youth experience things that impact them neurologically, physically, physiologically, as well emotionally, socially, culturally, and we cannot ignore that. It impacts them perhaps even more than it impacts an adult who has skill sets or perhaps a toolkit to be able to deal with it, to address it, right, to ask for help. We've normalized it as if it is okay and it's something that's a part of growing up, and it's not.
And kids will walk into it, and I think they're kind of trained to say, if I ask a child, are you okay? Yeah, I'm fine. Yeah, I'm okay. I'm good. And goes off and does something else. But then the problem that got you to that point just never is addressed. So now it's just compounding day after day, whether it was someone shot near their house or opening the refrigerator and there's nothing there to eat.
Well, that's what we call fawning. When we think of the different kind of responses to informed kind of like trauma, we need to understand, when do we see that people are fighting, right? They're trying to get their level of just self-determination and autonomy. They're fighting for that. And so it may show up in their attitude or physical fighting, right? Emotionally fighting, their tone of voice, their anger, the language that they're using. It could be flight. I'm getting out of here. I'm leaving. Right? Or it could be what we call freeze, where that is that aspect of being human that says, let me freeze this because it's too much for me to handle. And so I can only kind of put it up in my mind a little bit, but I'm not ready to defrost it right now. Let me control it. Or we can have what we call, the fawning, which you're talking about is, I'm okay because I don't want you to think that I'm weak. And by 2025, all of the 5,200 Boys and Girls Clubs across the country will have 100% of their staff that will be trained in informed trauma care, which I think is pretty phenomenal when we're working with like 3 million children and youth each and every day, sometimes on weekends. We're there for our youth and children and their families and the communities in which they reside.
I always say the best interviews are the ones where I don't have to say anything.
Okay.
And you said it all.
Okay.
Dr. Sharon, it's so good to meet you.
Oh, it's such a pleasure to meet you as well. And thank you for highlighting this because I believe as people are listening, they will understand that Boys and Girls Club is not just about having fun, but it's bringing fun back into the lives of children and youth. It doesn't matter if they're in Cambridge, Carroll County, Baltimore City, it doesn't matter. Every child, every single one should be humanized. Every single one should have an opportunity to grow up in a loving environment, to see it each and every day. And if we have those hours after school or weekends to provide that, we do. We're social investors to ensure their wellness, and we have to be intentional about it. So thank you so much for having us. We really appreciate
You're a joy.
it.
Thank you.
Oh, you're a joy as well. Thank
I
you
appreciate
so
it.
much.
Certainly.
Great. Thank you.
The conversation continues after this.